Bismillahirrahmanirrahim. My name is Professor Hussain Baksh Kolachi. I am a public health specialist and teacher, researcher. Today, my topic is World Drug Abuse Day, or normally called World Drug Day. And here, the drug we will define means the non-proper use of the drugs for other purposes than the medical purposes is our main theme of the day. And normally, it is called illicit drug trafficking, uh, drug abuse, and as well as uh, sometimes contraband drugs or illegal drugs. These are the names used. So coming to the Higher Education Commission policy, uh, that in all the institutions of Pakistan, higher education institutions, there is a policy on drug and tobacco abuse in higher education institution, and that has been issued in 2021. And even my university, ISRA University, has received this policy, and I am one of the member of this committee which will look into the implementation of this policy. The aims and objective of this drug abuse and smoking uh, policy, the drug abuse and smoking poses serious, and here smoking means tobacco and some other products just like ice and other things are also smoked or through the pipes they are taken or inhaled. Drug abuse and smoking pose serious risk to human health and the social life of the community have significant economic and environmental cost. The policy supplements national and provincial legislation on drugs and tobacco use, including the Drug Act 1976, the Control of Narcotic Substance Act 1997, and Drug Regulatory Act 2012, and the prohibition of the smoking in enclosed places and protection of non-smoking health ordinance 2002. Ordinance number is also mentioned in the slide. So this policy is actually envisaging the all these promulgated acts and laws and ordinances in Pakistan to curb this menace from the society, particularly in higher educational institutions. So this is the theme of the 26th is the day which is celebrated every year as an international day against drug abuse and illicit trafficking. We will define each thing for the students and the undergraduate. Let us define the drug first: a medicine or other substance which has a physiological effect when ingested or otherwise introduced into the body. So any medication for changing the physiological, here we means curing the disease, because the normal physiology is altered by the diseases, infections and other injuries. Drug abuse, the use of illegal drugs or the use of prescription or over-the-counter drugs for purpose other than those for which they are meant to be used, are in excessive amounts. So either you increase the dose or you use the drug for purpose which is not the main purpose or the actual purpose. Illicit drugs, an illicit drug is one that is illegal to have, for example, cannabis, heroin, cocaine, and now the ice. These are non-medical use of drugs that are legally uh, not available, such as painkillers and sleeping pills are also used. Drug trafficking is a major source of revenue for organized crime. So when drug is used for crime purposes or for other purposes, violent purposes, many of whom are involved in other forms of serious crime, such as firearm, modern slavery, and migration. And sometime now the trade organ is becoming people are given certain drugs and then they are transported or trafficked to the other countries and places. And under that narcotics or drug, the organs are removed. Narcotics is another kind of the drugs that mostly affects the mood and behavior of the consumers for the non-medical purposes, especially one uh, sold illegally. Coming to the point, the theme of this World Drugs Day is addressing drug challenges in health and humanitarian crisis. That is the crux of this theme. That's why in ISRA University and other organizations, just like the Hyderabad city, many universities in Tando Muhammad Khan, Tando Adam, Nawab Shah, and other Sakhar, Ladkana, they are also implementing this higher education policy. And 26th June every year is to strengthen action and cooperation in achieving a world free of drug abuse. And each year, individuals like yourself, entire communities, and various organizations all over the world uh, observe World Drugs Day to help raise awareness of the major problems that illicit drugs pose to the society. Together, we can tackle this world drug problem. So you can see this picture, a very young woman, how she is involved in such kind of illicit drugs or illegal drugs or drugs not used for the medical purpose, for enjoyment purposes. So what we can do from war zones to refugee camps to communities uh, apart, torn apart by violence, people in all parts of the world are in dire need. This year, United Nations Organization of Drug Control is addressing transnational drug challenges. So it is now an international problem stemming from the situation of crisis, whether this is a drought, disaster, war, or any conflict between nations or communities. We continue to advocate to protect the right to health for the most vulnerable. In these crisis situations, children, youth, people using drugs, people with drugs use disorders, and people who need access to control medicine. So these are the important aspects which this day will cover. And you can share the facts, you can share the knowledge and the information that is authenticated as United Nations and other organizations are giving uh, to this kind of drugs. So coming to the point, another what UN can do is that World Drug Report is given, statistics are shared, and in 2020, the world continued to witness widespread humanitarian crisis in Afghanistan, Ukraine, and elsewhere, while the COVID pandemic is still amid. So wars are there, unrest is there, violence is there, and pandemic is there. So these are the crises. Then the synthetic drug crisis also requires nimble and adaptable solution, a growing sense of global, because many drugs are now under synthetic forms. They are they were ingredient from the plants and other sources, but now chemically through other means, these are also produced. Uh, Care in Crisis campaign helps to make the World Drug Day a turning point in global efforts to tackle the drug challenges. So you can see this is a very important care in crisis. You can see the picture of a young girl, and she is looking that international community will address the problem of this drug menace so that she can have a healthy, happy future as well as a growth and development around her. Pakistan itself is recognized as a poppy-free means basic source of opium and heroin, and the Afghanistan is our neighboring country, and there is a kind of growth of poppy, which hopefully will be controlled through this new government of the Taliban. Drugs constitute approximately 435 billion US dollar of the economy or the trade. So you can understand that how much problem is because a lot of money is involved. Drug addiction causes 885 deaths daily worldwide compared to 49 deaths per day due to terrorism. So if you compare the terrorism, then it is almost 100 times more lethal, more dangerous, more destructive than the terrorism. Though the world is fearing from the terrorism and other things, but I think the real terrorism is this drug abuse terrorism. And a lot of money is involved, approximately 2 to 5 billion is utilized for the drug treatment worldwide. So look at the resources, how many resources are converted from the normal disease cure, normal disease patients to those who are using these illicit drugs or banned drugs. North Africa, Middle East, and Southwest Asia are the main regions for production of cannabis resin, whereas cannabis herb is produced in most of the countries of the world. Uh, Cannabis now is also used in certain medicinal forms and certain other industrial farms. Even the clothes are made from this. So anything which is useful can be made from this, but that should not be used for the player and as a drug abuse. Coming to the point that how much is the cannabis, if you can see that Pakistan, about 7 million Pakistanis are involved in take, taking drugs. So about 7 million, this is big number, amongst which 4 million use cannabis, while 2.7 million use opioids, chars, ganja, and heroin and other things. So you can see that how much is the problem. There are four main categories of the drugs, namely cannabis, opioid, cocaine, synthetic drugs. Uh, Shipment of maritime trafficking is the least used mode of drug smuggling, while road transport is used at the highest. So we have to control the roads. Cannabis has the most usage with the highest amount to almost, and you can see this figure is in at most 10 digits. The trend of synthetic drugs and cocaine is on the rise globally. An estimated number of 246 million people use illicit drugs. More than Pakistani people are using drugs. And this is the data of 2013, and around 27 million people suffer from problem of drug abuse. And you can see the burden of the disease. The annual number of people who die due to drug use is estimated at 1,80,000 and 100. Every one out of the three drug user is a woman. So if there are three, one is woman. However, amongst the drug users under treatment, the number of women is at only 1 out of 5. So the treatment facilities, access to the health care for the women, the annual number of people who died due to drug use is already mentioned that they are almost about 200,000. And Narcotic Force Pakistan is constantly mandated by government of Pakistan to counter narcotics, covering entire spectrum of all facets. Anti-narcotic force has 5 regional directorates spread along provincial capitals, with one regional directorate solely focused on the northern area. With this, I think the uh, anti-narcotic force burned narcotics amounting to 137 metric ton worth of rupees half billion US dollar, not half, but more than half billion rupees in 2020 and 320 million in 2015. So you can see from 130, we have burnt about 320, almost double. ANF not only directs its efforts to encounter drug menace, it also focuses on treatment and rehabilitation of the drugs. ANF has established 3 model addiction treatment and rehabilitation centers to provide free treatment, food, boarding, and rehabilitation. From 2005 till now, set up by ANF have treated about 14,000 patients throughout Pakistan. ANF has convicted 604 individuals in crime related to drug trafficking from 2014 till now. So this is an alarming figure in Pakistan. And June 26th is International Day already mentioned, and that was passed by General Assembly in 1987. This day serves as a reminder of the goal agreed to by the member state, in Pakistan is one of the members. So for the medical students and those who are interested, why people take drugs, either they want to have a peace of mind, euphoria, kick, calm, and pleasure, relaxation, and detachment from pain, and some romantic and other purposes also attached to this. Health problems are psychological, social, financial, drowsiness, inability to concentrate, loss, particularly the students who are taking any type of the drug, they are difficult, they have difficulty in learning, we call it learning disability. Loss of time, energy, and money, loss of weight, stigma, coma, and death by overdose is also common. So, memory disorders, difficulty in balancing cardiovascular system and liver diseases, infertility, decreased immunity, loss of interest, and violence. So, coming to the end of my presentation, why not to take the drugs? Anti-social activities are more, stealing, crime, violence, and terrorism are attached to the drugs. So this is another farm which is tobacco and marijuana and other farms. Then you can see that the intravenous drug use is there, alcohol is there, and then the progression of drug abuse. So the tobacco in health, you can see the chart, progression of the drug abuse, uh, tobacco, uh, and other drugs are given in which cocaine, marijuana, heroin, and these are the major problems. This is another chart. You can see that mental dependence, physical dependence, drug dependence, and drug abuse and drug dependence here means a continuous need of taking drugs. Route of administration, oral, injectable, as well as snorting and smoking. This is another category in which narcotics, hallucinogen, and depressant and stimulants. So these are the few effects and this is the cannabis and other things. Here you can see that how the young women are using and taking the drugs. So ultimately, if you take drugs from a healthy body, you are almost gone or a dead body. And these are the expenditure on the drugs. It is in billion, and you can see that medical care and medical aid requires a lot of expenditure. This is methamphetamine, we call it ice, which is very common nowadays in modern children and in institutions, and even there are certain rich families they are using. So the narcotic force in Peshawar is in action, and in other parts. It is easier to stay off drugs than to get off drugs. Uh, so you can see that awareness is the ultimate solution. And with this, I think Dr. Hussain Baksh Kolachi YouTube channel will provide you up to date on 26th. I congratulate and say to my student in ISRA University, as well as in the rural communities in Tharparkar, as well as in Kacho, Koistan, and all provinces, that we must avoid from the drug abuse and illicit drug trade, as well as create awareness through campaigns, walks, and other social platforms and mainstream media. Uh, you can see these are the symptoms and signs for the medical people, that you can have a blood shot in the eyes, as well as runny nose, a pale skin, weight loss, lack of coordination, and slurred speech. What is ice? Ice is a drug that stimulates the brain and nervous system. It is a type of amphetamine that is crystalline in appearance. That is why it is called crystal. Also, it is also known as crystal methamphetamine. Crystal meth, glass shirts and puffs are just, I have shown you the young girl uh, in the background. Once again, I can show you the same. You can see that this is how the ice is taken. Again, at the end, I am showing the ice in a picture, how this looks like. And the Higher Education Commission policy on drug and tobacco abuse in a higher education institution 2021 must be implemented. All acts in Pakistan are implemented, but the community awareness, research, social awareness, as well as the community participation in all the activities and the ownership. And we must link this with the Sustainable Development Goal 3, that is good health for all. So if we avoid these contraband drugs, drug abuse, illicit drug use, narcotics, then we can have a good nation and a prosperous Pakistan. Once again, please subscribe for updated information. Dr. Hussain Baksh Kolachi YouTube channel, and all the students of the ISRA University and the surrounding universities, they are also requested that their youth and their energy is more important for their family, for this nation, and for the international development. Please avoid narcotics, have a natural life, have a good health. Thank you very much.